Hey, who are you?
My name's Dhruv. Who are you?
I'm the one filming you. Where are you coming from?
I'm just coming from GP placement.
Nice. How was it?
Yeah, it was good. Got a lot of patients today, a lot of vaccinations. Yeah, we got a few mental health patients today, which was good because I haven't done that before. A few vaccinations, and yeah.
What was the exciting bit about being on a GP placement?
Just get to apply what we learned because we've been doing the cardiovascular exam, and I actually got to feel like pulses. Got to see someone that didn't have a pulse on their foot, and yeah, that was good.
Nice. You look excited.
Yeah, I'm actually really tired, but
Do you love being in med school?
yeah, it's really tiring, but it's exciting too, especially on days like this when you get to go out and yeah, experience what you've been learning.
Awesome.
Yeah.
Tell us a bit about yourself.
Yep, my name's Dhruv, first year medical student. I moved down here from Albury, and I play the bagpipes.
Nice.
There you go.
And how's med school like for you?
How's med school? Like honestly, it's pretty hard. Like when people tell you that med school is going to be easy, it's not really. You definitely have to put some effort in. You can't just rock up here and not do anything. But even though it's hard, it's definitely more interesting than like undergrad, I think, because in undergrad, depending on what you do in undergrad, you can do like a biomedical degree. You can do many other degrees now, actually, like psychology. But it's usually more theoretical. You don't really feel like you're doing something that like you're going to do for the rest of your life. But in medicine, you feel like you're more of an apprentice, like you're sort of on the job, you're doing clinical skills, you're talking to patients. So yeah, doing this, it feels like it's something that I'm going to do for the rest of my life.
Why medicine for you?
Why medicine for me? Look, I really enjoy science. I really enjoy biology, to tell you the truth, and I think it's really good. I think it's the perfect career because you can apply that knowledge in a positive way and help patients, improve patient outcomes, things like that. So I think it's really satisfying personally to do a career like that for me, and it's just so interesting. I'm naturally a bit curious. I like seeing new patients, interesting cases, things like that. So yeah.
What have surprised you about medicine so far?
I'd say the people I've met here have surprised me the most because they're not what you'd expect. They're not really the type 1 people who just study all the time, things like that. They really come from different backgrounds. Yeah, they're just so interesting and they surprise me every day. Yeah, and I learn things from them as well that I didn't know.
You came from the hospital today. What is that like?
That's probably my favorite, part of the week. I'd say going to the hospital or the GP. Alternatively, we have a 2-week split on that. Yeah, it's really good. You get to learn things, in the lecture hall and the tutorials. But with this, you actually go and get to apply it to a real setting, and there is a bit of a difference. So it's good to be exposed to the hospital and the GP clinic early on, so you sort of know what you're getting into and if it's for you.
With everything in med school, it is really time consuming. You have like a bit of time to cover really huge content, and everything else is really time consuming. How do you manage your time?
Look, I'm still working on it, to be honest. It's just do whatever works for you. Like I personally, I like going to the gym after a good session of studying. Once I'm really tired of studying, I just go to the gym, and then when I come back from the gym, I sort of have the motivation again to study. So I'd say do whatever works for you. Try to have a schedule of some sort. Have like a good sleeping schedule so that you can wake up in the morning and then study if that's what you want to do. But yeah, just like keep at it. There's no real like tricks or techniques to like reduce study time. I guess learn how to make notes better, things like that. Do flashcards. They can help a bit, cut down on the notes you have to take, but there's no real like trick. You just sort of have to do it and sort of just work your life around it. Sorry.
Have you changed your study style since you were studying in undergrad and now?
I'd say so. I take less like notes with Then in undergrad I would just take notes, but here it's sort of, I do take notes, but then I sort of like talk to other people about, you know, things as well, like just quiz them. I haven't got around to making flashcards yet, but I probably will soon as well, get into that. But yeah, I feel like with this, it's just, I'm sort of more testing other people, and I'm sort of just taking it more holistically, I think. I feel like in undergrad you have the pressure to get better grades and whatnot, because you want to get into medicine or any other degree of your choice. But here, it's more relaxed. You're sort of more just taking it in holistically as a general. You're just absorbing information, and you know, at the end of the day, if you don't get it all, that's fine. You'll learn it again in the future. So yeah, that's just my approach. I would say I'm not studying as hard, but I'm sort of just absorbing information the best way I can.
Awesome. If you Hey.
Oh, sorry.
What do you mean?
Nah,
You can jump in. Got Lizzie here.
You got Lizzie
You
here.
look good too.
I don't look good either. What are you talking about?
Oh shit. Okay. I'm gonna ask you like a few more questions. Is that okay?
Yeah, just a few more time.
At Unimel, we do like different discoveries.
Yes.
What discoveries topic have you picked and why?
So my topic is discovering cancer, my discovery topic. That doesn't actually start until second semester, but yeah, I chose that because look, in undergrad I really liked learning about cancers, like neoplasm, all that. So yeah, it was just an area of interest, and I saw it and I was like, sure, let's give it a good shot.
Does that mean you're going to be oncologist when you finish?
Oh, who knows? You know, maybe if I really have a good time there, I might decide. But yeah, at this point, I'm just keeping my options open about what I want to do.
Can you talk into it more? What does it mean, the discovery that you do?
So like my specific discovery. I haven't looked at the finer details too much, but I feel like it's similar to sexual health in that you have it's like case-based learning. You get some cases of cancer, and then you sort of just work through it. I think it will involve taking a history as well. So of the discovery topics, I would say discovering cancer is just a little bit more clinical than something else, which is perhaps another reason why I chose it. Yeah.
Outside med school, what do you do other than going to the gym?
Look, other than going to the gym, I'm a pretty boring person. I guess I just hang out with friends, you know. I like to go to new places.
That make your friend boring too. Ouch.
Yeah, they probably agree with you. Yeah, look, I just like hanging around with people here, going to new places, you know, trying restaurants, things like that. It's nothing too interesting. Yeah.
Nice.
But if there's any other hobbies that you want to do, you know, there's plenty of time to do that. I'm just a very boring person, so yeah.
That's cool, Mr. Boring Guy. Any last wisdom?
You know, don't worry about it too much. You know, if any of you are looking to get into medicine, you'll make it. Just you know, keep a clear head, try your best, and yeah, I believe in you.
Damn.
You got this.